Good evening. Thanks for joining us. I'm Stacey Skryzak.
And I'm John Hansen. Keeping up with demand, abortion clinics in Illinois, they're struggling to meet the demands for appointments since the reversal of Roe v. Wade.
Now, advocates, they want to see the state expand the pool of providers. As News Channel 20's Noelle Forde reports, they want to allow nurse practitioners and physician assistants to perform abortions.
Right now, nurse practitioners and physician's assistants can prescribe medication for an abortion, but here in Illinois, they can't perform surgical abortions. Many providers in the state want to see this change.
Clinics across Illinois seeing a surge in patients crossing state lines for abortion procedures. In the past month, 86% of patients at the Hope Clinic in Granite City were from out of state, when that number is usually around 50 or 60%. And wait times are now 3 weeks. Executive Director Dr. Erin King says in the past, patients were able to schedule appointments for the next day or even the same day.
We are in crisis mode in this state, and our own patients in the state just are getting the care that they need right now. So we have to continue to push to make sure that everyone has access.
Many organizations like Planned Parenthood say one way to increase abortion access in the state would be by expanding the pool of providers, giving nurse practitioners and physician's assistants the ability to perform abortions. And Dr. King agrees.
The more providers that can safely provide care, the better. Both for us, say as a healthcare organization, to hire somebody to provide that care, but also that means your community provider. So you live in Illinois and you go see your nurse practitioner, they can provide that care for you at their office as well.
Dr. King explains these providers have the proper training and believes it would be safe.
They do very similar procedures all the time, like endometrial biopsies and IUD insertions. There's all sorts of things that have very similar techniques to a first trimester abortion that would be very safe for those clinicians to also do.
But Amy Gerke, Executive Director of Illinois Right to Life, doesn't agree, and she has some safety concerns about it.
Next, this is just another way the abortion industry is showing complete disregard for women's health.
And doesn't like the idea of Illinois welcoming people in from other states for abortion procedures.
Making us an abortion haven is not going to do anything to improve our reputation. Illinois should be welcoming life, not increasing the violence that's already running rampant in our state with abortion.
And any changes to Illinois' abortion laws would have to go through the legislature. Right now, there's a House working group assigned to abortion access after the Dobbs decision. Reporting in studio, Noelle Forde, back to you.
All right, thank you, Noelle. Now, Governor Pritzker says he will sign any bill to increase abortion access that comes to his desk, which includes expanding the pool of providers.